especially in those who are much older. So, I started by saying this is addressed to health professionals and other pros helping an aging population. Well, I ask again, are you out there? And if I hear a loud no in many ways, I won't be surprised, not to indicate you're not listening to Partners in Health and Biz, but because of the loss we have and the help that we need for an older population. We are losing geriatricians like you wouldn't believe. When I was at the President's Council on Aging, a once every decade event started by Eisenhower, I was there, I think it was 2006 if I remember correctly, and we were already talking about this massive loss. We had something like 8,000 geriatricians for 31 million seniors, and we were going to be getting something like 4,000 geriatricians for 36 million seniors. And that was the guesstimate. A New York Times story that focuses on adults older than 75, or I should say 75 and older. That was roughly 31 million we're expecting to fit into that niche by 2030. And right now we only have 7,000 geriatricians. Now remember, it was 8 when I went to the 2006. So if we're 7,000 now and we expected 4,000, we are headed that way. And these are the people who know specifically how to take care of older adults. They need more time. They can't get more time. The American Medical Association says we have about 15, or the doctors, as you should know, the doctors have maybe 15 minutes to examine a patient. You can't do a real solid geriatric head-to-toe survey in 15 minutes. Heck, you can barely do regular care in 15 minutes. So we're losing geriatricians, and that just talks to the doctors. It does not mention geriatric specialists who are nurses, who are physical therapists. If you break your hip at 83 and you need, you've gotten the replacement and you need PT, guess what? You may need different help than if you hurt something when you were 45. So we are losing all these geriatric specialists, or we don't have them to begin with. We are losing our primary care practitioners. They're zipping at a loss. They just don't have the time. I remember interviewing an executive, a chief medical officer from one of the Alzheimer's major groups, and he was doing the story about early onset Alzheimer's, and say he highly recommends that the primary get acquainted with this. And I said, and he'd already been interviewed by who knows what leading media outlets like the New York Times and USA Today and CBS and whatever. I was working for a newspaper, but it was specific to seniors and not as well known. And so somehow I got the privilege of the phone interview. And when he said the primary should be asking about this, I said, well, that's great, but you know that 15-minute timeline, and the primary's already overwhelmed with taking your blood tests and checking your heart and watching your reflexes and a few other things. How are they going to add in checking for early onset Alzheimer's? And what was his response? I hear this dead silence, and he says, well, that's a good question. Nobody's asked that before. Fellas, are you out there? Are you as health professionals asking these questions? So you see the continuing ed or continuing medical education slide, and it's encouraging this. Are you asking your association, your hospital? Are you sitting down if you're in a group practice and asking, how are we going to achieve this? Because if we don't, we're going to see our patients going back and forth to the hospital even more. We get a bad reputation. They get a bad reputation. How are we going to be doing this? Mental health pros? We don't have enough now. And that's bundling everything together. The psychiatrists, psychologists, the social workers, the clergy, anyone who provides mental health type of counseling. We don't have enough for the growing population of older adults. We just don't. So who's going to be guiding their mental health? The ones of you who are out there, You better start finding ways to encourage other people to come into your field and not go into just the higher paying fields. It's become very desperate situation. I'm going to give you a quick checkpoint of some advice beyond medications. Yes, of course, if people desperately need antidepressants or opioids, they should be prescribed. But before, we have to get into, our health professionals have to get into the habit of finding other ways. It takes more time because you'll have to actually sit there and talk to Mr. Stevenson. But for example, if you've told Mr. Stevenson he has to lose 20 pounds, don't just shove him out the door. You must find some way to advise him, look, Charlie, you know what we can do? Yes, I'm telling you now, so you can put this in the future, you must start losing weight. But for now, let's start with 5 pounds. And at that point, don't just shove them out the door either. Find resources. Stuff that you know you would recommend, whether it's Weight Watchers, whether it's some other place. But give them options, phone numbers, whatever. And if Charlie can't use the internet well, make sure you're in touch with Charlie's daughter, best friend, whoever is his caretaker. And get them on that 5 pound track. All right, smaller goals. That kind of ability to achieve makes people more chipper. For fighting addictions, talk to patients and their families about the drugs that modify cravings and withdrawal, like methadone. Refer them to specialists. If you're the primary or you're the geriatrician, you should make sure you have contacts with psychiatrists, with outpatient clinics. You might have to check in your area an on-site option like SAMHSA. That's the government resource for substance abuse site. It will help you find options in your area. It's SAMHSA.gov, www.samhsa.gov. Okay? Counsel family members not to badger their loved one to stop using and say, you know, Susan, you can be stronger than that. Just quit, you know, or you're taking too many other drugs, Mom. You don't want to add this in. That's not the way to do it. You have to remind family members. Get them into counseling, the kind of counseling like Nar-Anon that will help keep people off of drugs and drinking. We didn't even bring up alcoholism. I'm sure you know that can be a problem. And in many of the older generations, that's what they were taught to use. When I did a report on post-traumatic stress in our older vets, I remember hearing about alcoholism in our older vets, because who was thinking of PTSD in World War II vets? And the guy said to me, well, you know, think about it. Didn't you hear about 3 martini lunches exploding, let's say, in the 50s and the 60s? And everybody coming to cocktail parties, whether it was for just friendly schmoozing or to achieve certain business options. So you think about that and you go, oh, yeah. Okay, so there was a different kind of addiction. It's nice that we're talking about the opioid explosion, but any kind of addiction can be causing trouble. So, as you can guess, this is just a very basic outline of mental health in seniors here on Partners in Health and Biz. And I trust this is giving you at least a little bit of understanding, some ideas. I hope it's inspiring you, actually, to get moving and not just sit there. It's got to be hard on your side. You're not getting reimbursements. You don't have enough people. It's going to be very difficult, but think about it. If our seniors are in desperate mental health, Lord knows what other health issues this country's going to have to enhance. So, I have a free giveaway. It's an infographic with a quick checklist of warning signs, and it also offers a toll-free number that anyone can call for help. If you're a veteran, if you're their caregiver, if it's you yourself, or you know a patient, someone who's having a problem. So there's the numbers and the checklist. If you'd like a copy, you can just email me at wendyjm.pih. So it's wendyjm.pih, like Partners in Health, at gmail.com. And please put addiction help handout in the subject line. I will add you to our mailing list for this and other upcoming materials. And don't forget that you can suggest story ideas. You can take part in our sponsorship. You can get more actively involved in a number of ways with Partners in Health and Biz. Just look up our PIH website, as I call it, partnersinhealth-biz, and you'll get much more information. If you head to places like Blog Talk Radio and now Spreakers, or I should say Spreaker.com, that posts us to Facebook, Twitter, YouTube. You can find us in a variety of places. And as I said, if you can't find us for some strange reason, I can't understand why, but if you can't, then you can email me. It's Wendy Meyeroff. There is no H like they put down here in the Baltimore area. It's Wendy Meyeroff, but you just send it to wendyjm.pih at gmail.com. Okay? wendyjm.pih at gmail.com. I only joined in April. I don't know when you'll hear this, so I have to remember my new Gmail address. Gail Dixon, as I said earlier, my intro person, our founder, my partner. Gail will be back next Saturday. She broadcasts 9 to 9:30 a.m. Eastern Time. I'm a sleepy person. I take the 10 to 10:30 time. This is pre-recorded, so I'm sorry I couldn't get your questions, but by all means, send questions. Contact us through the partnersinhealth.biz website. Thank you again, folks, for tuning in to Partners in Health and Biz. Do what you can to help provide better mental health care for seniors in this country while we try and provide mental health for everybody. Thank you so much. This is Wendy Meyeroff. Have a happy Saturday and continue to enjoy Partners in Health and Biz.